Mr. Ricci, you stated that hospitals and health systems have invested billions of dollars to protect patient data and defend their networks against cyber attacks. If all this money was invested to bolster their infrastructure, how is it that these healthcare organizations are still so clearly vulnerable to cyber attacks? You also argue that the federal government should be responsible for protecting hospitals against these attacks. How much would that cost the federal government? I'm sure you have some penciling out of that. And explain to the committee members why that should be the federal government's responsibility.
Thank you for your question. Yes, the hospitals do, in fact, spend billions of dollars to protect their networks. But as we have increased our digital health care utilization of network and internet-connected technology, ultimately to improve patient outcomes and save lives, that has resulted in an expanded digital attack surface. And often
Why is there a nexus between the two?
As we expand, the technology that we're using often has technical vulnerabilities in it that come to us from our third-party technology providers, which our adversaries are constantly scanning the technology to identify these vulnerabilities and develop malware to attack our networks.
And what about the money?
In terms of the government's money? Yes, it would probably require, I'm sure, significant expenditure from the government, but ultimately, these hackers are based overseas, sheltered by hostile nation states, which absolutely pose a risk to national security and broad public health and safety.
Do you think what the president has placed in his budget suffices?
In terms of the CPGs, the $1.3 billion, we believe at this point that is far from sufficient. In fact, woefully sufficient, given the 6,000 hospitals that would have to utilize that money.
Mr. Sheldon, you work with large entities in the healthcare sector to improve their cybersecurity practices. Were United Health cybersecurity standards adequate to protect sensitive patient information in your view? And if United Healthcare were your client, what would your recommendations be to them?
Thank you for the question. Unfortunately, I can't address a particular breach. I can say, though, that some of the best practices that we see used by people in this sector and other sectors are the usage of a managed security services provider. That's a very common thing at this point that helps organizations manage threats that are general, that target the enterprise, so that people who work on specific threats to the sector can apply that insight and energy about business process, about esoteric endpoints like medical devices and things like that, and really work on risk management plans to focus on that problem set. So that's a good one.
Yep. I don't know whether you can answer this or not, but there are two things about cybersecurity. One is the investment of a system, and I don't know how much confidence I have in hospitals buying the right thing, number one. But the other is that whatever system you set up, you have to keep it up. It's not just installing a system and that you can waltz off with all the confidence in the world that you're covered. Do you have any sense of what those two are across the country?
Thank you. One thing that we say in the security community all the time is that security is a process, it's not a destination. And we really emphasize that point because it's not the case that you can just pay for security one time and then set the problem aside. It's something that you really have to have a mature program that assesses constantly different changes in light of different threat activity and different technology changes. So
Thank you.
that's the most important thing, is to keep focused on it at a high level.
Mr. Garcia, welcome. Mr. Garcia is my constituent. He's a graduate of Palo Alto High School, so it's great to see you. It's always a source of pride to a member when one of their constituents is testifying. So,
Go Vikings.
yes. Do you think that the president's budget proposal is sufficient?
I agree with Mr. Rigi that it's going to need a lot more than that. But I think it's a good place to start, to see where we find the match between an appropriate amount of funding, particularly for the small, underserved providers, and minimum accountability requirements, that they have to go hand in hand.
Well, my time has expired. I want to thank each one of you. As I said, both your written, your oral testimonies are helpful to us. Thank you.
Thank you. The gentlelady